I am now the president of VACCRA, and I started January 2021. Let me introduce who's here today. Of course, you know Dan. Jim Trometer, who's a board member and a legislative committee member. Sarah Coleman, vice president for legislative affairs from Westminster Lake Ridge. Jim is from Cedarfield. Claudia's from Godwin House, Bailey's Crossroads, and our treasurer and website guru. Susan is standing at the podium from Windsor Mead. She is this year's senior vice president. And you know Betty. And I am Penny Jazz. And I want to take just a few minutes to explain how I got here today. Can we go right to the next slide, Susan? It's a quote, but it's a quote that sort of galvanized me. I had moved to a CCRC in 2014. I'd been at Covenant Woods for 6 years. And even though I have a PhD in government and public policy and spent 10 years in the Virginia General Assembly working with committees and consumer protection legislation and the Office of Consumer Affairs and the Office of the Attorney General, I wasn't really aware of what an island we were on. And that island is, there are 2,000 CCRCs in the country. In Virginia, there may be 55 or more. And we have no voice. AARP has a voice. I think the most stirring words I heard when I sat in the General Assembly at committee meetings was AARP representative getting up and saying, "Mr. Chairman, I represent 280,000 seniors. And we are here to support or oppose a particular piece of legislation." Yeah, cell phones off, please. When I saw this quote, I realized this really encapsulated for me why I needed to become more active. We have all entrusted our destiny to this young and relatively fragile industry we call continuing care retirement. This is an enormously complex national experiment, and it is in flux. CCRCs are a hybrid of nursing homes and post-55 communities and so on and so forth. Statutes and standards are run by the states. There's no national framework. Those statutes and standards affect finance, care delivery, governance, among others. So the many opportunities we enjoy in our safe communal living are frequently matched by the unresolved hazards of a national franchise. And the whole idea of the CCRCs is growing and changing. And we need to be aware of what those changes are. So this newsletter said we offer relevant information, ideas, and issues to enhance readers' experience in this important chapter of our lives. So I'm here today to ask you to join with us and be part of our collective voice. We have no voice unless we join together. Every CCRC, it's its own community. When you join VACCRA, you are part of a much larger community, and we hope to gain more members as we go through the year. Susan, next slide. Brief history. VACCRA is almost 20 years old, formed by resident leaders from 30 communities. 27 leaders met from 9 CCRCs at Westminster at Lake Ridge, down the road a little bit, or up the road. They reviewed current state laws and regulations and drafted proposed bylaws. Really forward-thinking people to have done this. Next slide. Greenspring was part of that forming group. You formally joined in 2003, and I understand we have a resident who was part of that effort. 2 VACCRA presidents came from Greenspring. Dr. Ronald Levin, how many of you remember him? Yeah, 1 or 2. And Peter Straub, how many of you remember him? And their dates. And Straub was invited to participate in a General Assembly panel on resident representation on CCRC boards of directors. Next slide. VACCRA's mission The group that met at that time named the group VACCRA. There are only 9 other state associations, residents associations in the country. Do you believe that? But there is one national association. So that is our parent group. Our role is, we're the only statewide education and advocacy membership association representing CCRC residents. We are dedicated to promoting and protecting the interests of CCRC residents in Virginia. And as I said before, we are the sole collective voice of CCRC residents. That's really crucial. What do we do? Or flip the headline around, our goals. We collaborate with other organizations, like-minded. We monitor legislative and financial issues. We coordinate actions on behalf of the rights and responsibilities of CCRC residents. A lot of that is back there in your takeaways at the table. And we foster understanding of how beneficial the CCRC lifestyle is. Next slide. How do we do this? The means we use. We maintain a comprehensive, up-to-date website. We issue carefully selected email blasts to members. We try not to overwhelm you because so many of us get so many email. I have 387 in my cell phone waiting for me to answer. So I need to just go through and dump some of the notices I get. So we're very careful about how we communicate with you and how annoying those emails can be. We publish quarterly, content-rich newspapers. We are at the end of the production for our 4th newsletter, Letter of the Year, and you will get those. You have in your hands the 3rd newsletter of the year, and we're really proud of the work we've done making these newsletters very content-rich. We host 4 meetings a year. In the old days, all of us old folks used to get on trucks and buses and go down 95 or up 64 or up 95. That's getting hard. So with the pandemic, it almost forced all of our groups to go ahead to Zoom meetings. So we've had all of our meetings this year via Zoom. And several communities are now having Zoom meetings in rooms like this so that everyone can manage coming and they don't have to try to manage it on their own computers. This year we had keynote speakers at both the spring and the fall membership meetings, and they addressed our key topics, which Sarah and her group will talk about a little bit later. Legislative and executive committees meet monthly. And we have 6 communities who designate directors on the board to make policy and decisions. Next slide, thanks. The results, from 2002 on, we have fostered closer relationships with NACRA, AARP, Elder Justice Coalition, and Leading Age Virginia. Leading Age Virginia finally bit the bullet and acknowledged that CCRC residents are stakeholders. What a surprise. We have, this past year, thanks to Susan and Claudia, we have pioneered a unique relationship with our parent organization, NACRA. And what that has allowed us to do is save a ton of money and put it where it counts. So we are using their membership management system, Club Express, and it really helped us modernize our operations. We really had stick stamps on the envelope and truck to the post office kind of operation, you know, with a lot of old-fashioned techniques. We were able to change so much of that in a much more modern operation for VACCRA. We eliminated the expense of an administrative assistant, $15,000 a year, I think, or 25, something like that. And we also eliminated the cost for website hosting. So all of that money has gone back into member services. This past March, the VACCRA president, moi, was elected to a 3-year term on the NACRA board. I'm the only state association member on the board. And the advantage of that is to watch all the old folks, the old guys and the old women. There's only 1 other woman, so there's 2 women on a 9-member board. But it's really interesting to be part of the national conversation of what's going on out there, what's developing, what's going on in other states, especially states like Florida that has 15,000 members in their state association. You know, just like, oh my gosh. So I'm really part of that dialogue, and I mostly listen in because I'm too new, but it's a good place for me to be. And this year, I took my checkbook out and joined all the other state associations as an individual member to exchange information, share newsletters, see what's happening with them, and maybe get them together in some kind of coalition. Next slide, please. Our lobbying wins this year. Quickly, I'm going to go through this for Claudia. Together with Leading Age, we lobbied twice against a bed tax in Virginia. And other states were not so fortunate. In addition to that, for the past two or 3 years with the AARP, went on a letter writing campaign to lower the 10% deduction for medical costs on your taxes back down to 7.5. That is not permanent. It is now permanent. Thank you. Thank you. Next slide, please. Our continuing lobbying efforts monitor changes to Medicare and Social Security, and I hope you are looking at your Medicare plans and comparing what you could do and what you have currently, because some of them do offer some cash back to your Social Security. One of the big things we did was support One Virginia, the constitutional amendment for redistricting. And that is still ongoing, and it's still a battle. With AARP, advocated for lower prescription drug prices. With AARP, got Medicare to count each night of hospital stay for observation towards the 3-day inpatient stay requirement for Medicare to pay for skilled nursing. The most important thing we're doing this year, and it's one of 2 legislative initiatives, which Sarah will discuss, is we began and continue to lobby for the complaint line and ombudsman for independent living residents in CCRCs. Really a spectacular initiative. Many other states are interested in what we're doing with regard to this. 2020 present, with VACCRA, we oppose the immunity, blanket immunity to nursing homes for harm done to patients from COVID. The state of Virginia put out an executive order saying that nursing homes were exempt. We oppose that, and with a letter and NACRA, as well as any other state association that wanted to jump in. Next slide. Next slide is Sarah's, and I'm going to introduce Sarah Coleman from Westminster Lake Ridge, who did an extraordinary amount of work this year shoring up a really thin legislative committee and legislative efforts and solidifying relationships with legislators who maybe have helped to us in preparing this legislation.
Residents ask, what is an ombudsman? Remind me of that. Residents ask, what is an ombudsman? What is an independent living ombudsman bill? And how can it benefit me? How can it help me? Well, first, an ombudsman is defined as an official appointed by the government to investigate complaints against public and private entities. Thus, for CCRCs, an ombudsman could mediate disputes and misunderstandings between CCR residents and management, or refer the disputes to an appropriate government agency. Although CCRCs are regulated to a, I consider, minor degree by the Bureau of Insurance in the State Corporation Commission, the official guide states that the State Corporation Commission, and this is a quote, shall have no jurisdiction to adjudicate controversies concerning CCRC contracts. This is important. There has never been an administrative mechanism in state government to address the problems and grievances among the large population of independent living residents in CCRCs. Nor has there been a means of collecting and assessing complaints for data to be analyzed. This means residents are unable to seek redress for their problems without encountering costly lawsuits. That's it. Now, since we have not had any administrative mechanism to address our grievances, it's important to note that there has been an ombudsman program for residents who live in assisted living and skilled nursing. They have had an ombudsman program for 45 years. And next, I'm going to, because you want to know, okay, so how can this ombudsman bill help me? I'm going to give you a few examples, and then I'm going to talk about how the bill can help the community at large. But for the individual resident, these are just a couple of examples. Administration, and these are based on complaints that we have heard quite a bit. Administration sometimes insists the resident move to a higher level of care and a more expensive level of care. The resident and her family say, no, I don't want to move. I'm perfectly healthy, capable of taking care of myself where I am. And so there's often a lot of controversy, and some residents have even filed lawsuits around this issue. The second is a second common problem is food service. Administrators frequently change the food service plan with regard to costs, which always goes up, and extra charges for carry out, when and how meals are served. We hear a lot of complaints from residents about this, but also they're complaining, especially around pandemic time, about the quality of the food declining considerably. The costs are going up, but the quality of the food is going down. My third example for individual residents is that often they'll ask for specific accommodations. At one CCRC, the residents asked the administration for 3 years, and this is while they were doing major renovation, to add bathrooms near the lounges where residents played card games and held meetings. The administration was absolutely tone deaf about the need of bathrooms for seniors, which we found astounding. The administration responded, oh, we don't have funds for this. This might even cost $25,000. But then they went on to hire consultants, paying one consultant $50,000 to make just suggestions and recommendations about how to improve the campus, how to improve the landscape. They also hired another consultant, and we don't know the exact cost, but it seems like it's close to $100,000 for talking about how to improve the nursing center and assisted living so they can get more residents there and can fill those spots. Okay, next slide. This is addressing how an ombudsman bill could benefit our communities at large. Many CCRCs do not adhere to Virginia's residents' rights and responsibilities. We have a handout on the back table that you can get as you go out that tells you what all these rights are. At some CCRCs, the administration tries to block the right to self-organize. They make it difficult in many ways. Some will not allow VACCRA to put any of our information in their cubbies. They are very picky about if you post something on a bulletin board. So this right to self-organize is often challenged and made difficult by administrators. Some even have gone so far as to subtly suggest ways they could retaliate if residents filed complaints. This is absolutely against the state developed rights and responsibilities. The next thing is many management companies are quite autocratic. They still function under the old business model that's not really changed, and we're trying to do that, of that they should be custodians of us. and they should be totally autocratic and take care of us in that manner. They refuse resident input. Two examples of that are the budget. Many CCRCs have asked, we want to be part of the development of the budget. We want to hear what you're thinking about and give you input. No, we don't want to write it specifically, but we do want to have input. And they consistently refuse. The other is a similar issue of long-term plans, where residents want to know, what are you thinking about? How much money are you going to spend on redoing the nursing care center and assisted living, things of that nature. So in brief, we truly believe an independent living ombudsman bill can benefit you as individuals, but also as a community at large. And now I'm going to introduce our esteemed professor, Dr. Tromaton.
Good morning. Please excuse the cap. I visited my friendly dermatologist the other day.
Get to your mouth like this.
Like this? Is that working? Okay. Thank you. Reemphasize some points. As near as we can tell, CCRC started in Virginia about 1883, and our president lives in the organization that started it, apparently. The Covenant Woods in Richmond, Virginia. The place she lives now bears no resemblance to the original facility. The health departments took over registering, regulating the healthcare portions of CCRCs. As part of that regulations, they included ombudsman offices. Ombudsman, as you heard, help to take care of where there are discrepancies between what the residents think should be and what the management thinks should be. Nothing happened for the independent living group. Apparently they thought, well, it's just like buying a house or going to an apartment. You're on your own and you don't need any help. That kind of ignores that today we spend almost $500,000 to move into a facility like this, and we're spending $5,000 to $10,000 a month to stay here and get services that we've been promised. So we are trying to get some form of regulation for independent living facilities. As was mentioned, there have been repeated studies that have indicated a need for regulation and even suggestions on how to do it. State Corporation Commission, as Sarah mentioned, has, under the insurance division, some regulations that they recommend for independent living organizations. They are pretty well spelled out. They cover mostly financial transparency for the residents. And as she has mentioned, oftentimes they are not adhered to. And as Sarah mentioned, they very deliberately said, we're not going to give you any way to enforce these regulations. So it's just hanging out there. Within the last 3 years, we have been working to get some type of legislation through the General Assembly that would let us have an ombudsman program in the state offices to help us out. The progress has been a little bit discouraging. One year they decided that, well, you really need to study this a little bit more. And so we went off and had another study, confirming what had already been done for a few years before that. The next time we came back, they said, well, how are we going to fund this? Where are you going to put it? And so it went to Budget Committee and never got out of the Budget Committee. not too surprising. Now we are working very closely with delegates in the General Assembly to get a bill before the Assembly in the 2022 session. We are consulting with them, advising, and they are working with the Legislative Affairs Committee to draft the bill. We are expecting to see a draft pretty soon, go through some revisions on that, and then start lobbying delegates to join in the effort. So if you do join up with us, we're going to be asking you to get in touch with your representatives, your senators, and tell them what you would like them to do and support the bill. And that's it.
And my job is to talk about, okay, we can go on. Residents' rights, who's doing that one?
Anyway, hear me? No? How's that? Go back to Sarah's slide. You know, put that in your mind. Together we can achieve more to improve the quality of our lives here, to protect against unfounded regulations that we don't want, to increase our resident participation in decision making. And really, if you can put that picture in your head, that will be helpful. Next slide. Primarily, we operate under the umbrella of residents' rights, and there is a number of handouts on the back table. And I'm very proud to say I pasted the stickers on every one of those multicolored file folders. So I learned from 10 years in working for the state of Virginia and addressing teachers that audiences like colors. So we had an executive committee decision on the kinds of colors we should have. And for those of you who are purists, there's about 15 pure vanilla folders back there as well. So I hope you got a color folder that you're happy with, and you can reach for it in your pile of white papers, and you can put all your VACCRA materials in that. So primarily, we are the spokesperson for residents' rights in CCRCs. And this will be our mission for the year: resident representation on CCRC boards, complaint line for independent living residents, ombudsman assigned to independent living residents, monitor CCRC financial soundness, effective management, seek greater transparency from the board of directors and CCRC management on financial soundness. Also increase resident participation in policy and decision making, even if they do it through small focus groups for the quality of your food. We are not just one-way communication here. We need to be sure that we have an interchange with the people who are using our money, and we need to have a say in how that money is used. Next slide. Now, here's Claudia.
Yep. So I am Claudia Blake, the membership and chair and treasurer. So how do you join? We join NACRA, and through that, or under that, we also join VACCRA. It's a joint membership, $35 per person for an individual, $60 for a couple. That gives you access to, or you receive the newsletter from both organizations. You have access to both websites, Is there anyone here who's ever been on the NACRA website or the VACCRA website? A few, good. I'd love to have Greenspring featured on the community page of that. All of these things, including the content in the newsletter, depend on people in the communities writing things, taking pictures, things like that, so you can all be active members in that way too. So you can join by going onto the NACRA website, nacra.com, and clicking the join button on the upper right-hand part of the page, or you can send a check to me and I will go online and do that for you. The check should be made out to VACCRA, even though it's both dues, because I have to deposit the money in the VACCRA bank account and then use the VACCRA card to charge your dues. Since the online program, the Club Express, uses credit cards. So your dues, as I say, are there for the individual and the couple. There's also another part of dues, which is for the community at large, and that's $150. Some communities have that paid by the Life Enrichment Department or Resident Services, management in some way. Some have it done by the Resident Recreation Association, by money that is given to the resident council. Different communities have different ways of managing that. For the $150, you get two votes on the board. You said you can have 2 directors who serve on the board of trustees for VACCRA. Then, is there another slide there or not? Is that the last one? Okay. If you are a community and you have at least 50 members, you can choose to become a chapter. Chapter has a few officers and organizes its recruitment and activities that surround VACCRA within your community. And the president of a chapter is also a vote on the board. So if you are both a community and a chapter, you have 3 positions on the board for VACCRA. And I think that's it. I will be at the back table afterward if anyone's ready to join.
Also want to say that we did reduce the dues when we joined with NACRA and knocked $10 off that. And the community membership has also been reduced from 250 to 150. Yeah, somebody else has the nacra.org domain and swiped it out right from under them, so that's always confusing.
Search the National Association Continuing Care Residents. So it's nacra.com and VACCRA.org.
Okay, if you Okay, we're going to open it up for questions and answers now. And Dan, if you would get one of the Yes, it was the first one in the stack.
Could you tell us which delegates in the General Assembly and which senators are your advocates and who are going to be working to carry the bill?
So I can breathe and tell you. Since last year, Delegate Willett, who is in Jim's region, has been very interested and has even talked to our group. He was at our members meeting this past spring and talked about being willing to support and co-patron. We also have Delegate Simons. She's expressed interest and she's met with us. So both of those have met with um, our legislative committee. We have a legislative committee, and also our executive board members. We've had nice Zoom meetings about that. Also, a recently elected delegate, Brianna Sewell, down in Woodbridge area, is very interested in helping. We have a couple of senators, but we can't mention their names because they haven't absolutely committed. And we are looking for others. Rob Willett, Rodney Willett, in Enrico County, yeah. So if any of you have a close relationship with someone who might be helpful, maybe you. Are you by chance Vivian Watts? Okay. Okay, I know of her because she's really been quite active in this since 2012 when Senator Barker hosted a big work group, and they really talked about some important issues, but nothing ever came of it after the very good conference. Nothing legislative happened. So, but Senator Barker has been involved and Vivian Watts. So there are people out there. We have not reached out to them at this point because of the election, and we didn't know who was going to still be on board at the end. And also we are in the process of working with an attorney, a young, very sharp, active attorney, in drafting a revision, as Jim talked about. So did I answer your question? Is that okay? Willett, it's Willett, Rodney Willett, from Enrico County. And we can thank Jim for, District 72.
Which may become 3 districts next year, who knows?
In the upcoming newsletter, I've written an article about the Ombudsman Bill, the Independent Living Ombudsman Bill, with kind of all the nitty-gritty of what's been going on for 3 years, so you can get more information from that. On the back table, Penny's already mentioned our very lovely folders that she put together, but there are 5 handouts there. There are 3 single-page ones, and then we have our new beautiful, thanks to Claudia and others, glossy brochure. And the newsletter, Claudia is a genius when it comes to IT issues, and she has put together the most remarkable website. It's just phenomenal. So she is our genius IT person.
I'm not familiar with the term bed tax. Can you tell us a little more about that?
Bed tax?
Bed tax.
The bed tax is a state tax that is put essentially on the cost of a bed in a nursing home every night. I mean, the daily charge. So if the tax goes through, it raises the cost of the bed, and so that, of course, affects our pocketbooks, no matter what financing is going on within each of our different CCRCs. The bottom line is that we will pay for it. It did pass in the state of Oregon, and I don't remember the exact percentage, but it was a large number of nursing homes went out of business, just closed down. We managed not to thwart the efforts in Virginia so far, not alone. We've AARP and other organizations certainly were there. Leading Age, I'm sure, was against it too. So, it pays to join with with other groups too and be a loud noise in Richmond.
I wanted to ask if Greenspring is a community member, and if so, who paid for it? And if we're not, what are the plans about doing something for that? Thank you.
We don't have plans as yet for that. I have talked with Chandra about this, and she's supportive of our joining. Okay, I always hate that mask. I say I have approached Chandra about this, and she is very supportive of our having a chapter here and has said that she may be able to pay that fee. But that's something we need to discuss, get together as residents and talk about this, because we need to, if we want to go this route, we've got to write the bylaws and those kind of things, decide where it's going to be. Is it going to be an independent resident activity, or would it be under the resident council? There's just a lot that needs to be talked about, but I think we have time. Excuse me? We were an active group up until, I think, 2015, and it was dissolved at that point. And we no longer have a chapter. So we have to start kind of over again with that, although I have a lot of that historical information. I'm sorry? I don't exactly know why it ended.
I just wanted to add to the something I forgot to mention with membership, and that's that if your group is 50 or more members, we as VACCRA give an annual rebate, $2 for each member, $3 for each couple, that you then, your chapter, your group has to organize itself to throw parties, if that's what you want to do, it's to encourage you to recruit, do what you need to do to recruit.
Elaine, I see you have a question. Many of you know Elaine Sorensen here. She was one of the initial members, I think, with VACCRA back in that day.
Thank you. I'm going to ask you to just listen to my recitation. I can no longer remember how to put together a presentation, but I want you to know that I was one of the original people involved in the formation of VACCRA and NACRA. So way back, I go way back. Then I retired. By the way, this is the start of my 28th year in a CCRC. So that in itself can tell you there's an advantage to being in a CCRC. My first one, my husband and I retired in 1993. And we had been very active in California. Both of us were healthcare specialists. And so we were involved with making a lot of the laws in California, spent a lot of time in Sacramento. And when the time came to retire, we decided to retire to Carmichael, which is a suburb of Sacramento. So that we were very involved. In 1993, a group of residents got together. Well, Florida is the stimulus of everything. You've got to remember that. And that in 1993, Bob Sparks, Milt Brunner, Maud and Jim Transu, Barbara Krings, and Elaine Sorensen got together in California. And we were, at that time, Florida was looking for some company, people who would be getting together to talk about CCRC rights. Well, naturally, California had a lot of population, so that attracted them. Now, let me just stop for a minute and say, I want to thank you people who are here today, because I'm so proud of what you are doing. And I look over the years, the things and the struggles, and to think that we have such a professional group of people. I'm so proud. Thank you. But back to this. So in that time, we got together, and we formed CalCRA after that discussion. And then we got, my husband, who had a PhD in public health administration, was a provider. So, and I was interested in the residents and in the recipients. Well, that benefited us, just like you are doing, the partnership, as you were talking about, building a team. We were able to present after 2 or 3 years of a lot of hard work, which you all know about. And there's no easy answer, folks. There's no easy answer. But there are easy jobs and there are harder jobs. And so if you don't want to do a harder job, at least do one of the easy jobs. But we were able then to get the first law passed in California. And pardon me, my allergies are really bad. But in 1996, the Residents' Right Bill was passed in California. And it took, I'm sure it was passed because we had ASA's support. That was what leading age was called in those days. Then after it was passed, ASA took that bill to Maryland to Barbara Mikulski. And she turned it into a federal law, the federal access for seniors. The reason that's important to me, I came here, well, after living in Eschaton until my husband died, I came here in 2001. And when I arrived, I saw notices that said that somebody recovering from hospitalization was in a nursing home down the road. And I said, how come? Well, no one here knew that the federal law had been passed that said if you were a CCRC resident, all other things being equal, you recovered at your campus. Well, so if you don't have folks like these people here telling you what's going on, there are a lot of your rights that you're just going to miss out on. So it's really important to be advised. And sometimes you have to say it over and over. If you're like me, you forget it the next day. So, okay, so in 2001, I was then asked to run for resident council. And I was president here for 4 years as the resident council. But in the meantime, I had been approached by Richard Graham, president of VACCRA, starting VACCRA, and at Goodwin House. And together we put some programs together. Oh, as president of the council, I had a little trick up my sleeve. I designated that some of the money that they had set aside for refreshments for the committee meetings would instead be the president's fund. And the reason they were doing that in the years earlier, I'm sure, was that there weren't a lot of people here and they had to keep catering busy. We used to have weddings in the chapel and events in this conference center. It was quite different than it is now. But I took that money and used it to drive people to meetings. We participated in all kinds of conventions and conferences all over. The idea is to be involved. And sometimes the residents would pay $5 to ride the bus, and the bus would pick up the rest of the expense. But you've got to be involved. It takes footprints, it takes people, it takes whatever. So you figure out a way. In California, I had our council became its own 501c3 so that we could receive grants and gifts. And therefore, we got some money so that we could go out and do something. There are tricks like this that you just have to know, but one of you can pass them on to the other. I'm getting all confused because I'm so excited to see you all here. But I also what else did I want to tell? Well, it really doesn't matter. We were very involved with the bed tax because it is a big deal. And we were involved with Vivian Watts when it came around to Medicaid beds. Some people said, well, why do we want Medicaid beds? That's for the poor. There are all kinds of rumors that go on. Well, I never thought I'd live to be as old as I am. And thank heavens that there are protections for people, who live longer than they thought they would. And so if we were allocated, based on our population here, 18 Medicaid beds. And we are able to use as many of those as we need. And of course it's a big help, even if it doesn't pay all of it, because it helps our fund that we fund every year to help those who no fault of their own are financially in trouble. All right, bed pay, Medicaid beds. What else? Well, I had a whole list of excuse me of things that were happening. I've been a life member of NACRA since it was founded in 1999. I'm just going to stop now and say three things in conclusion. First of all, you've got to identify your obstacles, and you are doing an excellent job of that. As an example, in California, it's the Department of Social Services and Health and Welfare Code that oversees CCRCs, and as has been said here today, here it's the Department of Insurance. What do they know about that? So how do you work around that? You have to have legal advice to know that. Secondly, many hands make light work. Your idea of team, I love that, because, as I said, there are all kinds of jobs that need to be done. And it's volume in many cases that makes a difference. If every one of you does not go and join, I'm going to be at your door, because you really need to get behind these people who are giving. My husband used to love to golf, and he'd say to me, okay, your passion is passing laws, so you go do that. We used to fly around the country to find something that you can believe in, that you can do, so that these people can do their jobs. And the third thing is, don't be afraid to dream a big dream. When I first came here, Gary Baldwin from Cedar Crest in New Jersey asked me about what was going on with board members in California. And he and I did a lot of talking, and he was really invested in wanting to have the law passed that said residents can be full voting board members. I'm happy to say that in 2007, a law was passed in New Jersey. So he's been working almost 10 years to get this done. But with a lot of help, it did materialize. You can't always have everything right away. So be on board and help these people do their job. Thank you very much.
Elaine, thank you so much for talking out. I knew you would do it. Thank you. More questions? I can't believe we don't have any more questions. There we have one.
One of your bullets mentioned a reduction in for taxes. That was apparently a positive. A reduction in eligibility. So if you can explain that, if you know what I'm talking about.
That's I believe you're referring to the threshold for the medical tax deduction, which is for the federal taxes, and it had been 7.5%. Then it was raised to 10%. So you had to spend 10% of your income on medical things before you could deduct them. It was reduced again. Is that the one that's just during the coronavirus? I think it's permanent now. It's permanent. So it did go down to 7.5% again permanently.
Also want to point out, the State Corporation Commission registers corporations. So your financial disclosure statement and your registry information for your CCRC is in their files. In addition to that, in 1985, they wrote the booklet on the Guide to Regulating Independent Living Communities. And this is where the residents' rights are in, as well as the small notation that says, we have no dog in the fight between disputes of residents and management. And that's the whole that we are addressing with the need for an ombudsman and a complaint line. On your taxes, Your long-term care, the monthly fee you pay, part of that is a medical deduction because the State Corporation Commission Bureau of Insurance regards these places as providing long-term care. So this is an insurance product. Yeah, we get a letter every year from our business office saying, you can take this. Yeah, you might question that. Yeah, depends on how your community does it. Ours does that. So, yeah, that's the connection. It is an insurance product, and the problem with CCRCs is we're a mix of Department of Health, Social Security, Medicare, Medicaid, what else? State Corporation Commission, Bureau of Insurance. I don't know how many agencies have some kind of say in pieces of how CCRCs are run. All the more reason that there should be a collective voice representing residents.
Yes. My question, as most of you know, our community here, we pay a certain amount down, and that comes back to us if we leave the community or if we die. It comes back to our estate. I've become aware recently that within the last year, it is now taking up to 3 years for people to get this money back. And I don't think most residents are aware of this at all. We need to be made aware. And have you dealt with this issue with other communities, with this kind of thing?
Yeah, this is part of the national conversation and the need for financial disclosures to be very clear and present a timeline for the return of your monies if you do leave the particular CCRC. And it's different in every state, too. So we are not aware of any community that this has happened before, but I hear it on the national level.
The state of Oregon had to go to their legislators and fight hard about that because it was taking more than 9 years for CCRCs to return the deposits to the individual's estate. And it was a hard-fought battle to make this an absolute, you have to do this in a timely way within a couple of years. Even a couple of years seems like a long time to me. But across the nation, this has been an issue. And I want to tell the lady about the tax deduction letter, medical tax deduction. At Westminster, we get a letter at the end of the tax year saying, this is how much you can take off from your income tax because of that it's an insurance product. And I want to say, I have allergies. I've had all 3 of my COVID vaccines. I know I'm hacking today.
In the contract that we signed, I presume and most people sign the same contract. It talks about a reserve for returning funds, but in an accounting set, I'm wondering what the accounting laws for 501(c)(3)s is because I'm familiar with financial institutions. When you put a reserve aside, that is a dedicated amount, and the those who supervise accounting standards require them to adhere to that. So I think it's a very deceptive part of the contract that we have signed because it talks about a reserve. I asked our previous financial manager. He said, "Well, no such thing exists." So I mean, it really bothered me, but of course I had no choice in the matter at the time.
Again, this is an issue with a lot of them that they're supposed to put in escrow a certain. Many of us thought it was our full amount, but no. And when you ask, I've asked a lot our CFO. Well, you know, you are supposed to be doing this, and he said, well, there's a little. And what we've found out, there are 2 things. One, they're using that money to do all of the capital improvements. And without those entrance fees, they don't have any money for capital improvements. They claim that our monthly fees, even though they're pretty hefty, only pay for the day-to-day kind of operations. So that's one of their big issues. There was one other point that, but across the country, there have been real concerns about misleading about what happens to our deposits and getting them back, and will the money be there? You know, we've had too many of these CCRCs that have gone bankrupt, and so people don't get any money back.
If I'm Ken Kauke, retiring liaison to the Finance Committee here. You're quite right. The deposits represent the capital in the organization. We don't have equity. We don't have equity rights, although we're stakeholders. We're essentially life leaseholders in our apartments. So those deposits represent capital. That's the net equity. That's the difference between the total assets and total liabilities. In fact, what we don't realize as residents is we have capital accounts. And if you get into the spend down situation where you run out of your own assets, that's where they draw in order to pay your medical bills. Now we have two kinds of contracts here. Before 2013 or mid-2013, there was a 100% contract in which the unit you occupy has to be reoccupied before you get paid out. And that is where the problem exists today, particularly after COVID. We had a net negative settlements last year of 98 units. And, you know, it's a struggle. Well, let me explain first. There's another contract called the 90% contract. Now, in the 90% contract, you get your money back. You don't have to wait for your unit, but there has to be money in a pool. As 90% contract apartments are reoccupied, the new deposits go into a pool. And there's something called a queue, and you have to be in the queue, and then you get paid first come, first serve. But the pool was exhausted last year because we couldn't refill apartments during COVID, simply couldn't show the apartments. And of course, people were dying and moving into assisted living and so on. So we did have releases. The releases are always there. Now, in the business of paying out those 100%, as the administration, Diana King, our new finance director, has said at a couple of meetings, and I'm not sure whether they were public meetings, council meetings, or committee meetings, but she said, she's admitted this is a problem, and there is what's called a mediation arrangement, whereby if you're really strapped, you can draw against your initial deposit, you know, after you've vacated your apartment. I'm not sure how that's exactly administered. It's something new, at least to us on the Finance Committee, but there is a kind of mediation, you know, a facility available. I think that pretty much covers everything that came up.
The other tricky issue.
That applies to the 100%. The 90%, as far as I know, still have to wait for the pool, which is happening. You know, they're paying out. The 90% are paying out. Diana said yesterday, at about 6 months later. So that situation has improved. We starting to refill apartments again.
Another tricky financial issue that's not clearly explained is about supporting residents till the end of their life, even if their funds run out due to no fault of their own. When we were signing contracts to go to Westminster, we heard that repeatedly. If for no fault of your own, you know, you run out of money, you can be here forever, we take care of you. The assumption was that they had set aside money in the budget for this sort of thing, but it's not true. What they expect are the residents, through the Resident Supporting Fund, to make donations to support these people. Well, maybe if the residents aren't able to or are not inclined to, then they don't have enough money. And the other issue that came up is we're living longer, the drugs are outrageously expensive, and they are struggling to keep this commitment of keeping people there when they don't have money to support themselves anymore. So when we talk about the contracts and the transparency, there are a lot of things that are rather nebulous and not clearly explained, and then you learn later. At Westminster, every single month at our resident association meeting, they spend 20 minutes talking to us about donating more money to the resident supporting fund. It is a constant request, and some of us feel badgering about making contributions.
Ken Kauke again. We're fortunate in that at least at the beginning and for the first 10 years, John Erickson was very resident-centered. That may not always be the case, but anyway. But with regard to what here they call the Benevolent Care Fund, or in some of the communities, care funds, there could be a deficiency in what's donated, and if there is a deficiency in a year, it is charged to there's a charge to operations. It's that simple. Oh, I should address, I didn't before, on the tax thing. The tax issue has been pushed by various communities in the Erickson system over the years, and back a couple of years ago, Riderwood across the river in Silver Spring, a large community with over 2,000 independent living residents. A group there put together a very professional paper arguing for a letter giving us the tax deduction amount, and Erickson management declined to do it. We never got an official explanation, but the unofficial explanation was it had something to do that we simply had too many communities and too many jurisdictions, and it was not something the lawyers wanted us to get involved in.
We'll take one last question, and then we're going to have to end, or maybe two.
I just thought I would
questions.
fill
Yeah.
them in. Here at Greenspring, we have the Benevolent Care Fund, as we all know, but we also have the legacy accounts, legacy trees, where people have contributed part of their deposit or part of their estate to that. And so right now, we have raised almost 100% of our goal for the Benevolent Care Fund of 320,000, I think it was. And we also have a legacy tree in the town center showing the number of families or individuals that have contributed part of their estate. And this is a long term then, knowing that we are going to be able to cover the expenses for individuals and have been able to. And each year as somebody passes away in their estate, this year we got a $260,000 return on one of the ones. We've had 2 new ones contributed this year of $250,000. So Greenspring is doing a good job in those areas at the present time with the cooperation of all of us.
Thank you, Richard. I think we have one additional question up here.
From the turnout today, it seems that there's a great interest in VACCRA here at Greenspring. And so I'm wondering, and I imagine we'll get memberships generated today. So I'm wondering, what are the next steps and possible obstacles for moving forward here at Greenspring?
That's one of the things that we're going to do at the end of this session and before they leave, is to talk about the way forward. Okay? Any other questions? If not,
Really great questions, too. Thank you so much for being an attentive audience and really engaged. Nobody left midway, maybe 2 people, but thank you. That really helps. Made our visit well worthwhile. Thank you so much again.
thank you all for coming, and I think Claudia will be available if there's anyone interested in taking out membership. I know many of you did as you came in. There is a sign-up sheet. If you'd make sure your name is on it so we can at least keep you up to date on what's happening. And be sure and take the handouts. So thank you very much for coming.